Thank you, Jorge, so much for the introduction and also acknowledging the Aboriginal people of Australia. I've been working a lot with Aboriginal people, Indigenous people here where I live in Forster Tuncurry in New South Wales. And what I really learned recently, really made me so excited is that the Western learning tradition goes through research and evidence-based practice. What sounds very much like psychology and medical disciplines. Yeah, research, evidence-based practice. That's how we Westerners learn. The Aboriginal traditions are storytelling, art, music, and dance. For me, that is all art therapy. So when I learned the Aboriginal traditions, that how much their learning goes through what basically an art therapist does, most of the time I spent with storytelling. I'm not interpreting, I'm not judging, I'm not looking for evidence. I'm just listening with an open heart, flexible mind, hopefully, playfully engaging with them. So today I'm going to talk to you about how arts can help you maybe in the work with treating trauma survivors. And I've worked a lot with trauma survivors, through working with Indigenous people, but I also worked in community health as a child and family counselor. I worked in child protection. I work with children who sexually abuse other children, what wasn't really a nice field to work in. But I've done a lot with trauma, a lot. I lived a year in South America in the slums. I lived a year in Africa in the slums and was quite exposed to this world. And I guess one of the interesting things what I found was that when people talk about trauma in psychology, they often think about what happened, this event. And as I worked a lot with people, I realized it's actually not about the event. It is much more of what we are thinking about the event, what we're feeling about the event. It's a whole processing of the event that actually traumatizes us. So I had, as you probably all have the same experience that I had, there are some people who had the most horrible experience in their life when they tell the story, but they're actually kind of okay with it. They digested it to some bizarre degree and can still smile, can still function quite well. And then you come across other people where you think, oh, this is just kind of seems like a minor incident, but it really hit them so hard. And when I work with them in art therapy, I find sometimes with people like that, I can work for years with them. So it goes totally against what the government in Australia is trying to do with 5 to 10 sessions, therapies through Medicare, and the focus is very much on functioning. Can we get mom back into work? How can we get her to pay tax, look after her kids? So for me as an art therapist, I don't think in those worlds. I think much more of what's actually going on for you? What happened? What are you thinking about it? What are you feeling about it? And I'm very patient and I allow people to make sense of it. I'm not directing people. So how do I do that? Because my job here, I was told by Nuria, I should not teach you art therapy. I should give you ideas what to use. So I have to get off my teaching and more into let's get some practical skills to you. So I guess the first thing what I do when I work with trauma in my head, it is about integration. Now, what is integration? Integration is a big word. I've grown up with a psychoanalyst. My mother was a Uruguayan psychoanalyst. And we never talked about cricket or footy. We always talked about feelings. My entire life with my mother was always about how are you? How is this girl in your class that you like? What's happening? I wish she would have talked about cricket and sport instead. So I grew up in this world of always about feeling. And as an art therapist, when people are traumatized, I find how do they integrate something traumatic? What can take years but often it can be much quicker depending on the client. I cannot accelerate their healing, I found over the years of doing that. I wish I could. When I work as a psychologist with CBT, I can be very focused and I can be very clear in the process. But as an art therapist working with trauma, I have the experience, especially when I work with the unconsciousness, that I cannot accelerate their healing journey by my clever interventions. My experience is much more that the client heals herself or himself through the artwork, through the discussion of the artwork, as fast as they can, as fast as their own unconsciousness allows them to progress. And how do I know that? I see it in the artwork. They do the artwork, they express themselves through pottery, through painting, drawing, sculpting, dancing, music. And then they verbalize what's happening to them. That's how I witness the changes. And I ask questions about it that are quite neutral. They're not manipulative coaching questions. They are more questions of awareness. Tell me about it. What do you see in your artwork? It's a very patient process. And my experience, the way integration works really is it starts physically with the body. So somebody has been seriously traumatized, and they often can't talk about it. They can talk formally about it, what happened, but emotionally they can't grasp that experience. But physically, they can express it. Like, how in narrative therapy, we often talk about externalizing. Like you're thinking about something depressive, like the dog, the black dog of depression. You're thinking about the black dog that pulls you down, that is depressed. In art therapy, the good thing is we don't have to think about externalizing. We can physically externalize. So now I have these art objects in front of me. Jorge shared that he used to do pottery. So now we're creating something out of clay that is very messy and we can't control it. That's a physical experience. In my body, it all feels so messy and I can't control what's going on for me in my body. And the Gestalt therapists often talk about that in the body, something gets stuck. There's a blockage. And so what I find in art therapy, by doing the art physically, we're breaking slowly and gradually through those blockages as fast as the person can. So we're starting physically. Often I talk very little to my clients at the start. We do a lot of different art expressions, and I'll give you more examples later as we go. But it can be any form of expression. Yeah, it doesn't have to be restricted to visual art. It can be a dance. It can be a movement. That's beautiful. She shows where you're blocked. Often when you get emotional, the unconsciousness pops up. So that's the clue that I look for as an art therapist. Where does the client get emotional? When she talks about her artwork, when she sings a song that she has written, the way she moves, the way she touches the clay and stops touching the clay, and a tear might be coming down. That's when the unconsciousness becomes conscious. And I ask her, what's going on right now? Can you share that with me? That's a very powerful moment. So the processing and the integration of art therapy happens first physically. Then the emotions come in. People start feeling when they're looking at their artwork, when they're experiencing the art making. And we're capturing those emotions by them sharing their emotions. And it's not the emotions just focused on the trauma. It could be any emotion. So I'm not just constantly talking about trauma or expressing trauma. the body and the mind brings up those things as they feel natural to you, to the client, in an organic way. So it's not about controlling the client and directing the client. It's much more an openness and an invitation to create, to play. I worked a lot with children, even 3-year-olds, preschool children in child protection. It's amazing what they come up with. Allow them to play, allow them to be playful, and what needs to come up always comes up. It's actually quite remarkable. When I give this invitation to create, every session, something meaningful comes up for the client. Like that sounds crazy, I know. But when you work with the unconsciousness, it's not a deliberate process of coaching the client somewhere. It's more like the client, as he or she expresses, starts talking about what they express. And as they talk about it, they start having little insights. So remember this, the process starts physical, it becomes emotional, and towards the end of art therapy, or it might not be the end, you can't really tell when that actually happens, they start intellectualizing it. They start rationalizing. They start using their mind that says, Rob, I know what that is, what they're seeing in the art object. And I ask them, tell me, what do you see? And then they say, well, it's a big shit mess. Right. Tell me about the big shit mess in your life. And that's when they become emotional. And they start telling their story, but they're also putting it into context. And that's why I call it rationalizing, intellectualizing. So now the mind is trying to put things in context. So the goal really of good art therapy is, get this is really important to understand. As we go with the process and we're achieving integration, like say half a year or 2 years later, the client will still remember what happened. That memory doesn't go away, but she doesn't feel it anymore. And that is sensational. So with all my clients, when we get to trauma integration level towards the end, they say, Rob, I still know exactly what happened when I left this country and how I arrived here, but somehow it doesn't hurt any longer. I have not this emotional response any longer. I know, I can tell you exactly when we were persecuted, what happened to my mom and dad, how they got killed. But I'm still sad about it, of course, but the pain is not there anymore. So it appears to me that our body, in a way, in our mind, and our whole being is designed to deal with adversity. So we are not hopeless victims of violence. We are actually quite amazing how the worst things can be thrown at us. And if you experience a form of good therapy or good support or love or mentorship or whatever that is, really, or you have a lovely grandmother who supports you, we can end up with in a form of integration where the pain is not felt anymore, but we still remember. And that's quite remarkable. So when I work with trauma victims, or I often have in my mind, the goal is integration. That the pain is not felt anymore, it's not so emotional anymore, but it's still understood and put into a bigger context. So, and I do this process with a lot of different art materials and art engagements. And I know I'm supposed to talk to you about what to do in an artistic way. So I'm moving up now from the theory more to practical bits because that's what you want to hear from me and not my boring theory. You probably know all that already, what I've said. I just wasn't sure how well you know it and how experienced you are in this work. So I thought I'd just still throw it in. Um, that some of you might still think, wow, this is good. This is good to hear. This is what we're working with. As an artist and an art therapist, I tend to choose art materials that are easy for the client to work with, allows them to engage. Remember, the first engagement is physical. So it needs to be something that is tactile, sensory, inspiring, engaging. So I have beautiful art materials. I have beautiful paint, beautiful crayons and pencils, not from Kmart and Big W. I use high quality art materials. So the sensory experience is engaging, emotionally overwhelming. The clay is rich and big and generous, earthy, that you want to touch it. You want to smell it. You enjoy the mess making, and I am generous with the mess making. We have space in the room, and I know how to clean up the room. So the client is allowed to just be free like a 3 and 4-year-olds who can jump into the puddles and mud without mom telling them off that they're making their clothes dirty. In art therapy, yes, you can get dirty, and I have an apron and just bring clothes that from the op shop, and we can make mess on the wall and wherever you want to, because life can be very messy indeed. And that's often what clients do in art therapy. They don't express a sexual perpetrator. They don't draw about a sexual perpetrator. What they're making is mess, because that's what they feel. They feel the loss of control, the overwhelming sensation of what's the point? They lost to a degree trust into this world. You know what we hopefully get in the first 2 years of our life when we are babies, we through attachment, we get this secure attachment. But when you go through trauma, that is seriously endangered and questioned. Can I actually really trust this world after what just happened? So now we have to work on attachment again. And through art, it's beautiful because art brings you back to this early childhood where mess is okay to a degree. I love it when little children eat and all their gooiness comes out of their mouths and the table gets all dirty. And then you have some of the parents who constantly clean up. They come with the cloth and they wipe everything off. And it's hard to tolerate as an adult because we have learned to be clean, to clean up after ourselves. But the children themselves, they don't want to be clean. They live in that gooiness and messiness and mud and enjoy that process of abstraction of world. So it's not figurative and concrete, but it's just everything. Freud would talk about the anal face. I'm not going there. But it's all part of that creation and messiness that sometimes really stinks. And we have to learn to deal with that too and let go of that. So it's a lot about playfulness art therapy. So when I have clients in the room, we work with mess. Now my experiences working with art therapy is there's kind of two very different type of clients after trauma. And you might like to hear that. Some clients after trauma become very internal. They don't show much affect. They are very numb in their emotions. They don't speak much. They don't show much emotion, like a deeply depressed person, frozen emotionally. With those clients, I have the experience that the best thing works is art materials who are kind of the opposite of what they are like. So if they're emotionally numb, I use art materials that are very emotional, like wet paint, wet clay, big mess. So it kind of creates a Jungian balance in the client. So in a Jungian way, the client is emotionally not there. It's more in a rational place, intellectualizing life, but not feeling anymore. So as I introduce now mess and paint that inspires emotion, the client actually enjoys that. They love touching the wet clay, getting their fingers full of paint, and experiencing the mess brings them in touch with their emotions. Whereas the opposite of that would be a client who comes into your counseling room after something traumatic and is very emotional, is very loud, is very aggressive, maybe, or cries the whole time and cannot stop crying. In a Jungian way, again, I'm looking for the opposite in art to balance them. So instead of mess, I give them control. I give them art tools that are more on the rational side. So somebody who cries and screams or is very angry and aggressive after trauma, I give them color pencils or even black and white pencils, an eraser, a ruler, a small format, a piece of paper that's very small and restricted, contained, or a mandala that you can, get from the internet or photocopy black and white, and they just color it in and stay within the lines. That is so calming for somebody who is so emotional, so overwhelmed with their own emotions. So you can see how art therapy, when you start working with art tools, is a lot about balancing. That's kind of, I guess, the goal is creating a balance within the client through the art tools. So when you, as a counselor, want to work with art with your client and introduce art, have a look how they present themselves. If they're highly emotional, go low, go easy. Pencils, something simple, coloring in, just to let them get comfortable with you. And that gets to a stage when they start expressing more feelings. No, sorry, when they reduce their emotions, become a bit more rational, when you can start introducing other art materials. And the same for the opposite. Somebody who's not very emotional, bring in wet paint so they start feeling. So it's kind of all about this kind of a balancing act, process oriented with your clients, see how they're moving, progressing, not talking much at the start, allow them more to express. And expression can be many things. It's not just drawing and painting. Of course, your client might enjoy writing songs or writing stories. Or I have a lot of teenage girls who love dancing. So they create their own dance after trauma. I worked a lot with indigenous children. I work in indigenous communities where we went in to heal the community. I had a special training with 9 other elders, and I was the only non-Aboriginal person. It was a very privileged situation. We got 20 days training, and then we went into the community where they experienced severe domestic violence and child sexual abuse. So we went into the community, and what we did is what the indigenous people naturally do, is dancing, storytelling, craft making, telling a story, art in sand, with rocks, with fingers onto the body. So don't feel limited by what you think art can be. It's really about the expression. Bring it out, externalize, like in a very narrative way, externalize what you're feeling in your in your body somehow in a creative, playful way. And the unconscious just has this amazing capacity to go into the art object, whatever that is. This is the most amazing thing for me because my mother used to be a psychoanalyst and she just worked with words, whereas I work with art expression. And what I notice is when people express something artistically, the unconsciousness projects always into it. So you cannot help yourself, but the moment you do something artistic, your unconscious is in it. That is quite remarkable. And Jung knew that too, Carl Gustav Jung. So it's quite remarkable when we work with art, it is much more than you think. It's not just an artwork. The person's soul, the pain, and everything, and the resources are in the artwork. Always, every single time. And it's so powerful that whatever matters most to you right now goes in every single art object. So if I'm asking you now to do a picture, let's say I get a shoebox and I say to you, on the outside of the shoebox, present yourself how others see you. And you, with creative materials, you create this outer shoebox, like a self box. Then take the lid off. And then the inside of the shoebox, express what's really going on for you. What really matters in your life? Who are you deep inside? And my experiences with trauma, with victims of trauma or torture, the trauma and the torture is always inside the self box. I don't have to tell them that. I don't have to say, oh, you have to draw your trauma inside. No, no. Draw inside what's going on. How do you feel? Who are you truly? Not only outside how people see you, but who is your true essence? If I ask that question and somebody went through trauma, it's always in that box. So the unconsciousness, in a way, is driven to come out. And by creativity, we're giving a path for it. We're giving an outlet to the unconscious to easily flow out and project. So in every single art object, whatever's going on will go into this art object. And it is so insane that I once taught a psychologist who worked in a prison system. She's a forensic psychologist. And she said to me, Rob, your art therapy diploma was the best thing I've ever done. And I said, what do you mean? You're a clinical psychologist and you have a master's in forensic psychology. So surely you have done better thing than my little diploma course. And she said, no, because when the inmates, when the prisoners make their artwork and they start talking about it, everything what they are experiencing deep inside comes up. If I would ask them as a psychologist, what's going on? You know what? They wouldn't tell me anything. Why would they? I'm a stranger. But through the artwork, it comes up. And then I reflect back to them, is that what you're experiencing? That at the moment, nobody is listening to you and you feel so lost, like you used to be your entire life. And the inmate looks at me and tears are coming down and he says, how do you know this about me? I haven't told you anything. But it is so true. Can you tell me about it? And now comes the story. Out of the artwork, the emotional story, and starting to understand, intellectualize it, and put these things into perspective. So this is a lot how I work. It's not, I can't predict, but I know that in every session, something meaningful will come up for the client that makes them to a small degree sometimes emotional. Sometimes it's very tiny. When you work with very depressed people, you don't expect much emotional response. But even that they're attending, they keep coming, even though they don't feel much, they don't see much. I worked in serious psychiatry as well, where people were locked up for years in Munich in a psychiatric research hospital. And as an art therapist, I worked there. And it was remarkable how people who don't feel much, who don't see much, they keep coming, they keep coming, they keep coming, and then they start talking. Little comments, just some little things. And you're just listening, acknowledging, saying, wow, thank you for sharing. Is that what's going on for you? And they suddenly start telling you a story. Same in the indigenous community. They don't say much. Of course, I'm this non-indigenous white dude. Why would they tell me anything? But through the art making, they start telling their story. And as they feel they can trust me or this opposite, they become emotional. And they know they're safe. And they know it's confidential. And it has to come out. And they feel that it's right, it's the right time to let it out. And I work a lot with people who don't speak well English. I've been teaching in over 40 different countries. I mentioned it to Jorge before. And sometimes the language is quite difficult, but we still get through it through the art. And sometimes I say to people, well, if you can't say it in English, say it in your own language. And then they say, it's horrible. And I said, so tell me about what is horrible in your life. And then they start telling more. So it's we try to be very playful about it, or I try to be playful. And and I lived also in many different countries. I was very fortunate. I grew up with a journalist father as well, who traveled a lot the world. And often I learned to communicate with my hands and fingers. Like I was in Kiswahili. I didn't speak Kiswahili in Eastern Africa. I didn't speak Luo. So I had to kind of gesture and find a way. And I learned a lot from children because they don't mind if you can't speak their language. They can still tell you what they want from you. So you are on that level as an art therapist. You know, you don't take words too seriously. You don't take anything too seriously, but you're very open-minded. You have a big heart. And as an art therapist, when I teach art therapy, I always say to people, you don't need to be an artist. You don't need to be a psychologist, but you need to have a big heart, be very open-minded, and just allow the client to make sense of what they're experiencing. They are in charge, and you're just assisting them to get those insights. So from alone, we can't work on our own unconsciousness. So we still need that therapist. We still need this art therapist or this person who is asking the right questions that allow us to go to that deeper place. So when I work on my own unconsciousness, I can't do that. So I need someone else to ask me the right question. And then like, oh, now I know. And then my art therapist asks me, what do you know? Well, blah, 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 blah. So I hope that was helpful. I think I've done my 30 minutes. I want to take away from Shima's time. Um, yeah, pleasure sharing a little bit with you. I hope you got something out of this.